Let's go to your before and after photos.
Okay.
Pretty impressive. For people just tuning in, we're talking about aqua shape liposuction. Dr. Ditesheim says you're literally washing the fat away. You go in with a traditional cannula, the water shoots in, and then the cannula, there must be some sort of a suction device that's pulling the fat out, and it's low downtime. They could drive home. So let's take a look at some of the results.
Take a look at this woman, Randy. She has, if you look at her before picture, she's in great shape. She's young. She's like 5'6", 120. I mean, she's a marathon runner. She's in great shape. You think, so what is she doing in my office? Okay, but if you look at her tummy, she's got the round tummy. She's had children. She's got a little tummy pooch, very normal. She said, you know what? As great a shape I'm in, I don't have the confidence. I won't wear a bikini. And I'm like, you're kidding me. She said, no, I won't. And she said, this bothers me. And she points to her tummy. And I said, what do you want? And she said, I want that to be flat. Okay. So under local anesthesia, with no drugs, right? Just numbing the area. She has that done. She drives herself in. She drives herself home. You look at her after picture, right?
It's flat.
It's flat. Look at the front view. And you can see, now that is a beautiful athlete. Now she feels beautiful. She is really an athlete. She was an athlete before she came to me.
How long does it take you to do something like this?
That procedure took an hour.
So 1 hour of something that has been bothering her for a while.
Now, here's the difference with AquaShape. In 1 hour, where you can drive in and drive home, she took no pain medicine. She had a result that was immediate. She looked just like that the next day. I don't know of another procedure, and there's lots of different ways to get rid of the fat. I don't know of any other procedure that can do that.
So you're convinced this aqua shape lipo is the best approach to liposuction?
For me,
in your opinion?
In my opinion, it's the best.
Okay,
now,
good.
I will say that not every patient is a 120-pound marathon runner, right? And we'll look at
Can you do the larger patient?
Of course you can, right?
Okay.
You can do the larger patients. We do them under different types of anesthesia, a little bit of anesthesia, more anesthesia, what makes the person comfortable. But this is an example that I've repeated over and over again in hundreds of patients where there is a defined amount of fatty tissue in someone who's in great shape. There are so many women who are out there thinking, well, I'm in good shape, I don't need liposuction. Like we wrote in that article, I exercise so I don't need liposuction. But you know what? Everyone's got a little bit of fatty tissue, a little tummy, a little love handle. What would make the difference? Okay, so you're wearing that dress that really is form-fitting, and you don't want it to bulge in the lower tummy below the belly button. Or you're a guy and you're wearing something that's like, wow, okay, so you're in good shape, but now you have a six-pack. So it's just, will it make you feel better not to have that?
So if you're bothered by this this fat, this genetic fat, whether it's a saddlebag, whatever, do something about it.
Yeah, if you're bothered by this, if you're bothered by it and you feel like, gosh, do I have to have that? No, you don't have to have that.
Okay,
okay.
okay.
Now, let me show you, can I show you another example?
Sure.
Okay, so here's a woman. She comes to me and says, you know what? I just want more shape. My lower tummy, I'm frustrated. I won't wear certain clothes. My thighs, you know, I want to be sexier. And I said, okay. And I show her. I said, look, here are the curves. Here's what I see. This is what I think we can do. And when you look at her after picture, you see, wow, that's confidence. That's the confidence that she didn't have, that she was hoping to get. So when you look at her after picture, you see, wow, she's got a great shape. All the things I promised her are there. She's got a different body from the front to the back. You can see it. Now, what's even better than a great after and a patient that's happy is a patient that 4 months later sends me a picture on her trip to the Caribbean. Okay. She sent me that picture. It came in my email. I said, I'm having a great time. I feel so sexy. It's like, wow, what could be better? I didn't prompt her to send it. Okay. And you can see in her smile, in her expression, she's like, yes, that's where I want to be. So the question really is, can you help me get where I want to be? And sometimes I have to say, no, I can't. But with this procedure, what I can do that's different is, yeah, I can do this with less recovery than I was doing before. And I know that patients don't take the pain medicine they took before. Therefore, they get back to their life quicker. They go back to work quicker. It's it's better.
Because people talk to me, I have friends or they email me like, what's the hot new procedure? And I said, well, according to this one plastic surgeon, he says aqua-shaped lipo is the next big thing, and it works.
So look, here's the reality. If you have, everyone's got some stubborn fat. We know that, okay? Something that you want to just get rid of, that's fine. For most plastic surgeons, they do liposuction. It's not what they like doing. They want to
That's true. They come on my show, they go, Randy, I don't want to be stuck doing lipo all day. You like it, though.
Right. I like it because I can use the finesse and the artistry and the sculpting and combine that with understanding the technology that, okay, I've got something that's safe, it's predictable. You know what it all comes down to? When I tell patients, they want a predictable result and a predictable recovery.
Okay.
Surgeons are trained to get predictable results, and the recovery is their problem. But that's not what my patients ask me. They want predictable recovery. If it's too big, they won't do it. They're scared. Why are patients scared of all kinds of big surgeries? Because they're scared of the recovery. So I said, okay, I'm going to find out a better way to do what I do. And I can tell you that this is a better way. Why don't all surgeons do it this way? Because for a lot of surgeons, they have a way to remove fat. They think, and maybe this is the difference, is that, okay, if you have extra fat and I'm sucking it out, then everybody's happy. And the more I suck out, the better. And I know some surgeons that they market themselves or they pride themselves on how much they can take out. Okay. I don't want to do that. I want to do what helps the person, that woman or that man, get to where they want to be. And I want to do that in their time frame.
Now, I don't want to interrupt you, but I know you want to show a bunch of photos and we're short on time. So what else do you have?